So yesterday we have talked about the school building, its planning and functional requirements. Today our topic is a hospital building, place where people are treated for various diseases and give advices for healthy living. That is a hospital. We all know about it. That for a healthy life and for treatment of the disease, we need to go to the hospitals and where we meet with the experts in the field of this medical science, and they will advise us and cure us from from that particular disease. So human health and hygiene conditions that are two important goals with respect to a hospital building. So and that actually these are the main objectives we can say. Likewise, we have studied the school building. The main objective was to transmission of the knowledge in terms of voice from from the person who is delivering to the person who is receiving, that is experts and the students. And here the aim or goal is to maintain a proper healthy condition, hygienic environment, and ease of we can say that ease of moving. Okay, so the important things that one should consider is the psychology of the patients. See, we have to focus on this psychological conditions also. In school building, there are there was a little participation with respect to this psychological conditions, and most of them we have already covered with the proper lighting conditions. And here also it is required to control this psychology of the patients. And as we all are aware, with the negativity and positivity incites us, and that's why we have to focus on this parameter. Lighting condition, ventilation, these are the basics. Acoustics, that is the noise control. Obviously, noise control is very much important when we talk about a hospital building. Orientation of the building, a thermal comfort, aesthetics, color scheme. Color scheme will again affect the patient's behavior, or we can say that it is again a psychological factor. Circulation, entry and exit. Circulation is very much important parameter that brings the ease of movement, and that is one of the most needed requirements of hospital building, because there will be a crowd, a lot of crowd will be there in that building, and people should have an easy access on each floor, on each facility, okay, with easy circulations. So that is the overall aim of designing a hospital building. Entry and exit should be large enough to accommodate the cases with the people of disability, or with the cases that we can say that emergency cases where we have to make arrangement directly by taking the patient down from the ambulance and etc. So entries should adopt these facilities too. So probably they are widening enough to provide such facilities. Okay, so these are some important points. So first of all, again, starting with the site selection, some of the factors that we have discussed in yesterday will remain same for this class 2 of hospital building. But there are some additional parameters. These are the well connectivity from the city area. That means by a road or any transportation system, there should be a well connectivity. But again, there are some special types of hospital buildings, and they're required to be separated out from the cities. Okay, especially those are prone to delivering the infections to the other citizens. So, like I'm giving an example of a hospital that is properly dealing with tuberculosis, TB. So that is quite infectious to others and to other citizens of the city, and that's why it should be properly distant from a particular region or the main city area. So it should be well connected, but again depends on the facilities that it is to be delivered by this particular building. Okay. So next point is quiet place. The place should be quiet. That means the patient or the person who is treating the patient will not get disturbed by the noisy conditions, by the surroundings, and the proper planning is therefore required, and better site selection will help again in this way. Land should be enough to give an open planning. By means of open planning, that we have looked some plans like the alphabetical shapes, like H section we have discussed, C sections, U sections. So that are all the plans which provides direct opening to the building and from its surrounding actually. So there may be proper lighting condition, there may be a proper morning sun. So that is all advantages in a hospital building. So a proper site selection is important in this manner while we are talking about a hospital building. Okay, there may be many other factors, and some of them we have discussed in the earlier classes, and that's why I am not repeating them again. So the next one is your planning, the very important thing, because not only the site selection but the arrangement of different facilities inside the site, that is again important. And that's why see, the planning is broadly divided into three sections while we talk about a hospital building, and these three sections are generally outpatient care, or we can say that outpatient department, inpatient care or inpatient department, and emergency unit. So we have three different classes of planning, or we can say that overall planning is been divided into these three sections. So outpatient department or outpatient care, that is sometimes more popularly called as OPD. Okay, so these are actually services related with the people that are coming to the hospital from outside, and actually they are the persons who are not admitted into the hospital, right? So these are the patient who are coming from outside and not admitted into the hospital. The inpatient care deals with the persons or the patients that are accommodated or admitted into the hospital building itself, and various wards. There are a number of wards. So depending on the case or disease, type of disease, they are separated into different wards. Again, emergency unit, that is again a different part. See, the important thing is that this all should be planned in such a way that each of them should have an separate entrance, separate exit. That is important thing. So one should not create difficulty in other components working. Okay, so this all should have uh, not only the separate entrance and exits, but also proper entrance and exit. Okay, by means of proper, that is the width and height of the entrance should be quite good. So that is the thing which I was discussing, that separate entrance. Again, diagnosis, treatment, administration, and research and educations are different part. These are small facilities within hospital. The major facilities are divided into these three segments. It is outpatient, inpatient, and emergency unit. Okay. The important thing again, that is the way we are developing a hospital building. That means we are going in vertical direction, we are moving in a horizontal direction, or what should we adopt. So always try to make a judicious combination in between this two. We can say that uh, adoption of this verticality or horizontality of any site. So a best suited site will be such that which have a minimum floor but having a high area in the horizontal direction. So we can say that in other words, we can call it as a horizontal spread type. That means it is spreading on a floor level, not by floor to floor. On individual floor level, it is spreading. So that is desirable one. But yet we have different cases in cities, uh, especially in the cities where land is so much costly, and that's why we have to move in the multi-story dimensions, and sometimes we have to manage with different floors and by connecting them with lifts and staircase facilities. Okay. All the ward and department should be easily accessible from the main entrance. That is the very obvious thing, that the wards and the department should be easily accessible, not only for the patients but the visitors too, and for the staff. We can say that medical staff or nursing staff, whoever is working over there. So that should be easily accessible. Again, X-ray and radiological department should be accessible for both types of patient. That is, by means of both types of patient, I'm here again counting for those who are coming from outside of the building, hospital building, or those are within the inside of those hospital building. That is out outside patients and this inpatients. Okay, so they must have an easy access for this X-ray and radiological department too. Again, we have some special, we can say that is special specifications for this outpatient department, that is OPD, and what these factors are. Let us discuss one by one clearly. So, main job of an OPD is consultation. That is important. It is not consolation. Please correct it. It is consultation. So, main job is consultation and investigation about the patient's problem, diagnosis and its treatment. Okay, and patients are not admitted into wards generally. They are uh, they are being treated with the help of the medicines, and proper advice is given by the doctor. That is very much important. And if required, and then they must be admitted in special cases. But generally, OPD patients are not admitted into the wards. That is a basic thing which is considered in hospital planning. Consultation in a good manner required some time management, and that's why there must be a waiting hall for the people who are waiting outside for their turn to be checked up by the doctor. So there must be a 1.4 meter square per patient area. That means just deciding the capacity of the hospital, that it can be a this this number of beds hospital, and it will require a waiting hall of 1.4 meter square per patient. So suppose we are designing for 100 patient, and that means directly we have to multiply this 100 by 1.4. So we will get the area of its OPD. Okay. Again, there are different consulting rooms within the OPD, and these are the rooms for the medical services. These are the for medical facilities of the department itself, and these are the ENT, that is ear, nose, and throat, and dentistry, and gynecology, orthopedics, psychiatrics, skin, urology, etc. So different OPDs are there, and with reference to the different types of disease the patient may have, they will serve by consulting them in these individual facilities within the department. Okay. Again, there must be suitable area for dispensary where the medicines are kept separately. Floor area for each individual consultant, that is for medical unit, for this ENT, for this dentistry, gynecology. It should have a area of 10 meters square to 12 meters square. That will be enough. Uh, Proper care should be taken for the entrance, and entrance must have facility for the wheelchairs. That means we have to provide a ramp over there with proper slopes. Okay, so entrance should be 3 to 5 meter wide first of all, and it should have a headroom of at least, we can say that at least 7 feet to 8 feet. That is the minimum requirement. Emergency section should have an area, that is emergency section within this OPD, that should have an area of 10 to 15 meters square, and dispensary unit that I discussed earlier, where we kept the medicines, and that should have a separate area of 20 to 30 meters square. So that are all the specifications related to this OPD, and we have some more specifications with relation with the inpatient department. So inpatients are actually the patients that are admitted by the hospital staff, and they are living within the hospital. Okay, so consists of facilities required for the treatment of patients that are admitted into the wards. And ward number one facility is the wards itself, the operating theater, radiology, pathology, psychiatric department, emergency department, ICU, that is your intensive care unit, and pathology, laboratory, pathology is repeating here, laboratory, mortuary, postmortem room, etc. So these are all the facilities and to provided with respect to this inpatient department. Okay. Next we have wards, how the wards will be planned. So important thing is that ward is an area where nurses and doctors will take care of the patients who are admitted into the wards. So they must have a clear vision to each and every patient. Okay. So each and every patient should need to be examined carefully and at least to be observed carefully by the doctors. That is sometimes relating with the self confidence of the patient too, that yes, the doctors are visiting me time to time and I'm being helped with the staff. So that brings positivity into him or her, and that's why it is important to plan the wards in such a way that the nursing staff or the medical staff can have a direct vision of on the at least 50% of the patients that are admitted, or on, we can say that on the 50% of the bed of the patients that are admitted into the ward. Again, we have different wards uh, that are a maternity ward, that is related to the birth of a child, and cardiology, pediatric, surgical, emergency, etc. So we have different types of wards, and each ward required its own facilities. It is the main center of activity because most of the patients are admitted by the hospital department and their relatives, friends, and we can call them as a visitor. So visitor may come into this area frequently, and that's why it is generally more crowded area compared to any other facility within the hospital premises, and that's why a proper circulation should be maintained over these wards within this ward. Okay, so there are again general and special wards. These are depending on the economical classes of the patients that are admitted. A general ward have some facilities which are lower than a special ward. Okay, so these are again required to be planned in different manner. That special ward will come with the special features like the arrangement of air conditioning facilities, heating facilities, etc. So these are all required to be planned carefully, that what should we have to provide, what type of service we are giving to the patient who are in a special ward or who are in general ward. That is important. So area, the basic, we can say that as a thumb rule, we should select area of the board as the area of board per bed area is 8 to 10 meters square. That means a 40 bed hospital is there, so we can calculate easily the area of board required. Okay, so 24 to 30 beds are generally provided. That is the minimum criteria, that at least this much bed should be provided by the hospital staff. Bed should be visible from the nurse station. That we have already discussed a lot about it. Noise should not be greater than 40 decibel and 35 decibel. See, there are two different units. One is 40 and the other one is 35. The first one reflecting the noise control in the daytime, and the second one reflects the noise control in the night time. So there is a difference of 5 decibel in between both of them, considering the daytime and nighttime activities within the hospital premises. Again, it should have a proper opening space because we have to take care of the patients by its surrounding too, because it should not be an area. You can consider yourself that sitting inside an enclosure for a long time period, and that area is completely separated from the atmospheric conditions that are outside. You are unaware with the things that are going outside. Okay, no proper environmental, we can say that elements are there, that is lightning, uh, the direct sun, the winds. So it is quite uh, we can say that it is quite disastrous for someone's mind and someone's mental state. So we should take care of these things too. So at least a window area of 20% of the floor area should be provided. Okay, so suppose there is a 1,000 square feet area, so its 20% area should be used as a window area, that is opening, that is to be provided into the walls. Okay. Again, circulation, as I discussed earlier, is most important thing, because the wards will be the most crowded area, and therefore 25 to 40% of the floor area is, we can say, that reserved for the circulation of the patients, medical staff, nursing staff, and for the visitors too. Okay. The nursing room and the dispensing should have a separate area of 10 to 12 meters square, and a morning sun is desired. That is what I discussed. Again, the next important part is the operating theater, or sometimes shortly called as OT. And this must, it must have an easy access from the wards. A 20-meter square to 30-meter square area is generally considered safe for these operation theaters. Circulation of nursing and medical staff is prime most requirement of this kind of departments or particular room. And width of corridor is generally 3 to 4 meter. That is the corridor leading a person from the wards to the inside of this OT. So it should be at least 3 to 4 meter wide, and all joints should be sealed to prevent the infection. That is, the operation theater area is quite sensitive area, and you you might be aware with the thing that without the permission of the doctor, no one is allowed inside to that room, and it is all because the visitors may have chances to be infected by the patient who is treating inside, and that's why proper care should be taken so that the infection should not be spread outside of this OT, and the person who are working inside this OT will also uh, work with proper care and proper safety. So joint should be sealed properly. That is the main motto. And doctor's room should have a space of 10 to 12 meters square. That is inside this OT, a 10 to 12 meters square should be reserved for the doctors. And uninterrupted power supply and the controlled conditions. That is the controlled condition of the environment. Okay, these are the two main important things and written in the capital words here. So by means of controlled conditions, that means the conditions of the air, surrounding humidity and temperature. So these are all important things. Uh, Outside the points that are mentioned over here, there should be a good facility for washing of the tools that is being used by the doctors. So proper sinks should be provided inside this OT. Okay. The next one we have is a radiology department that directly deals with the X-ray photographs and the radiation therapy that is to be provided to a patient of cancers. Okay, so that is again important. This room should be first of all separated from the other facilities of the hospital building. Uh, it have an X-ray room, a dark room, a store room, a waiting hall, light room, radiologist room. That is the person who is taking care of this individual department. Okay, so these are all important things should be considered while planning a radiology department inside a hospital. It must be separated from other parts of the building, obviously. X-ray, why I'm saying so, that it should be separated, because these X-rays are harmful for the person who does not require to be examined at that time. And sometimes you have observed, I think you might have observed this thing, that nobody is allowed, even the doctors are kept themselves outside of these X-ray rooms while X-ray is being carried out for any patient. Okay, so these rays are just harmful, and we should uh, we should be uh, we should be safe from this disastrous X-rays. or even sometimes the research activities or the education activities require the use of lasers inside these hospitals that are again the we can say the dangerous one, and one should have a proper space and proper separation from that race too. Again, from construction point of view, the uses of wall and the floor or the ceilings that should be prepared with the help of a dense concrete. That means concrete which is not having voids. Okay, so proper vibration and heavy thickness, we can say these are all the requirements so that the extreme rays cannot go outside and harm the other persons. Generally, we have to accommodate the X-ray equipment inside this board, and or we can say inside this department, and their height is generally ranging in
Can
between
you
30
again
100
repeat
to
the whole concrete
okay.
sentence again?
Yeah, sure. I
Thank
was
you, sir.
discussing that in case of this radiology department, we have to take care of the walls and the floors or the ceilings. That is the concreting work overall. That there are chances that there must be opening inside the wall due to its we can say that uh, poor labor work or due to uh, not taking care while the construction is going on, due to poor construction practices actually. So we have to take care of these things, and this opening should be covered properly, and probably we should use a dense concrete over there. Whether there is opening or not, we should use a dense concrete, and that is thicker enough to avoid such an accidents. Okay.
Okay, sir. Thank you.
Interesting thing is that okay, sometimes we use special plasters on these balls too, so that they can be separated out again from the extreme heat that is caused in the uh, hot summers, because these rooms not only required to be taken care from inside out radiation, but that are also required to be get suffer from the outside in radiation, that is by the sun's heat. Okay, so generally barium plasters and etc are provided on to the outermost surfaces of this department, so that they can be separated from the heat of the sun. Okay, I hope it is clear.
Yes, sir.
Okay, thank you. The entry for this department or this room should be 1400 mm at least, and the wetting area is 1.3 meters square per patient outside the OT, obviously, and a massive quality of radiation release, extremely heavy shielding is required to contain it, that we have discussed. Again, we have a pathology department that is generally dealing with the testings. Okay, so laboratory uh, design should be adopted over there. That means a platform is to be provided. While I'm saying a laboratory, that means it is creating a picture inside your mind that there is a platform, or there are a number of platforms actually, and they all having a separate sinks, and uh, they having at least a space of accommodating the things required to be required for the testings of the various samples and etc. So these are all important things. So a laboratory type planning or laboratory type facilities should be provided. Okay, and again, small offices should be there for the persons who are working inside the laboratory, or we can say that this pathology department, so that they can examine the report and consult with the patient directly. Again, uh, toilets should be provided inside this facility. Tests are carried out for the urine, blood, and human excreta, etc. So we have to plan in such a way that it should not create something trouble for the patients and for the doctors too. Okay. So generally, 18 meter square area is selected for this kind of facilities for proper accommodation of the all the things that I have discussed in just few minutes back. Okay. Sanitary units. I'm not discussing sanitary units here because you can say that it is your task actually. So you can just move on to the building by laws and National Building Code guidelines that is being prepared in 1983, and I think it is again revised in 2015 or 16 maybe. So you should read this guideline. That is important thing. So you'll get some important points or important outcomes from there. So it is a kind of assignment for yourself that how sanitary units to be fixed up in the hospital buildings. Okay, so these are provided with the norms of the local building bylaws or NBC regulations. Obviously, these building bylaws are just coming from this NBC regulations. So most of the things will remain same most of the time, and you should learn or read these specifications about the sanitary facilities. That is quite interesting. So I advise you to go through this standard codes that are mentioned over here. Okay, and see, viewing the sanitary facilities, that is one important or basic thing. That is, the door shutter should be open outside. That is, the shutter should not open inside. Okay, why I'm saying so? Because there may be chances of the patients who are inside the toilets or bathroom that they may go to unconsciousness at any time. So proper care can be given to them by the staff that is on the outside of such facilities. So that is important thing, and actually basic thing, very basic thing. So we should care about these things while designing a hospital building. Okay, so these are all the different facilities and the specifications related to with these facilities. Okay, here is a rough layout for a hospital building. You can observe it and ask for your queries. Look at the arrangement. Here we have an office, or we can say that administrative area actually. Here we have nurses room that is near to this administrative area. A veranda is provided for easy circulation within this floor. A storeroom and a toilet is provided that is perhaps for the staff working over there. And here we have a dispensary, consultation, examination room, a waiting room here, and a veranda. Again, that is the OT or operation theater in the middle. And see, this size of the corridor, it must be 3 to 4 meter. What I was talking about. Again, here we have different limbs joining with the veranda, and you can call it as corridor too. So we have different wards facilities here. Uh, so you can see that this ward is having quite larger area compared to any other facility because it is the main center of attraction of an hospital building. Okay. This is your clinical lab that is for trial, and X-ray laboratory is here. It is again in a shaded place and in a separated environment. And we have a toilet over here. There must be some toilet arrangement, toilet and WC arrangement within this wards too, and that shall be accessible by the patients who are inside the ward. Okay. So doctor's room is here, and that is a special room that can be used for in case of emergencies. Okay. So kitchen and laundry are arranged in the backside. So this can be a rough layout, although most of the things are missing from this plan. And these are the arrangement of OPD and IPD, what we have discussed. So I think we have included in our experimental, or we can say that in lab work, uh, planning of a hospital building. Yes or no?
Yes,
We
sir.
have included it or not? Okay.
Yes, sir.
So these are the important things, and you should be aware with this thing. You can also access to our educational blogs. Please visit our website www.civilaffairs.com. These are the services in which we are dealing professionally. Please do like our videos, subscribe our YouTube channel, and share it with your friends if you find this content helpful for you.
Thank you.